just really quick information to get Dr. Makovich started.
Wow,
Thank you,
it's a lot of information.
I know.
You're like, what was that? I think a part of it too, Veronica, is it's early, it's Saturday, we've been practicing all week. We're like, just get us through this thing. Whose birthday month is this month? You guys, some people are actually on top of stuff. I'm like, last time, I'm like, okay, let's get it done. So, and my talk is, I'm a chiropractor, been practicing for 23 years, 24 years almost. I live in Upland. You know where Upland, California is? Upland, about an hour away? Oh, you guys know where Upland is, great. It's a small city. We just upgraded our office back in end of December. We upgraded our office now to new location, new building, paint, carpet, everything else too, walls. A lot of it is, as you guys already know, you guys are chiropractors, you know this stuff. Can we help anything to what to do, what not to do, right? That's the biggest thing. Who's ever, and don't answer the question, don't raise your hand. Who's ever been sued before? On state board, don't raise your hand if you did. Part of my talk is going to be how do we avoid getting there? How do we avoid doing the things that we think are right that some patients may think are wrong? How is our perception going to be help to the patient to make sure we understand, help them understand what this does, the adjustment does, to help them improve their health? We have to, unless you're a non-contact doctor, we have to put our hands on people, right? So we want to make sure it's safe, appropriate for us and for them. What I mean by safe for us is we don't hurt ourselves either. Who's ever had an injury adjusting somewhere or just in life? I have many, okay? In chiropractic school, my first semester I was lifting weights, boom, popped my shoulder. Tore my shoulder. I was in a sling for about 6 months. In first semester school. I was like, can I practice? I don't know, I'll see what I can do. But over the years, I want to take care of my body, which I'll give you some of my things I do that help my body 23 years later still be healthy, strong, and stay that way. I think a lot of it is, as chiropractors, I have a couple buddies of mine, even the practice I took over, I bought into 20 years ago. I was associate for 3. He went out with a back injury. He had to have, I don't know if you guys have seen it before, someone who has the TENS unit inside their back, where it's actually implanted in their back, like a robot. A lot of it is he took care of himself a little bit, but waited too long to get chiropractic care himself. How many people are in solo practice? By themselves? And so he didn't have a partner to adjust him. So when he finally got care, it was kind of too late. He had to sell his practice. He had done well financially, he was done. But physically, his body was wrecked. How do we avoid that for ourselves? And obviously being an example for our patients too. Okay? So a lot of it is, and again, you guys know this stuff, but sometimes we wait too long to listen to our own advice, is can we stay strong enough in our field and flexible enough so we can actually enjoy a long, healthy career? Okay, you young doctors, good for you guys. But a lot of this, I'm 50 years old, I'll just be honest, I'm 50 years, turned 50 this year. I've had some injuries, shoulder, knee, ankle, ribs, playing basketball, other shoulder too, no wrist stuff yet or elbow stuff. But a lot of it is, can we do enough for our body to make sure we can stay healthy before we even have injuries? How many people here work out, say, a couple times a week? Good. Boom, boom. Okay. Your doctors before didn't really worry about that. They were too busy with practice, family, things like that, so they waited too long. If you can stay healthy by working out, staying flexible, staying strong, have good endurance, at that point, a lot of us can actually enjoy, like as we have been, a long, healthy career. I think that's the key with the longevity chiropractic. I think before, when I came out of practice, most chiropractors retired between probably 50 and 55. That was longevity back in around 2000. Now chiropractors are being more diligent, being their own, if you want to call it being their own athlete, who take care of their patients. I see probably on average, about 300 people a week. This is what we do. We're high volume practice. And I think by doing that, allows me to help a lot of people. It also gives me the experience, as this is why I'm here, is to kind of walk you through, and as confirmed as you've already done, of what's going to work for everyone's practice in general, right? Everyone's different. Everyone has personalities. Part of it is, before we adjust someone, what do you think is the number one thing we have to be able to get them to understand what the adjustment is going to do? How do we communicate that? I've kind of answered my own question. How is your communication skills with your patients. This is important, right? We all know, we're all chiropractors, this will help a lot of people to adjust people, but how do you get them to understand it may not just be one adjustment, maybe that magical adjustment. So we understand it may take time and educate your patients that this may take time based on their injuries, right? Sometimes I have people come to my office, you probably have to, you kind of laugh in your head. I've had this problem, doc, for 10 years, my lower back. It's been horrible. I've done medication. I've looked into other therapies for one too. I've done my own home stuff. I've done heat, ice. Now they want me to do surgery, but I'm here because I want that one adjustment you can give me to make this go away. Who's ever had that story? Isn't it phenomenal? Like, who told you this? Who lied to you? You know? So we have to make sure our patient understand the reality of chiropractic, not just their perception, right? Okay? Anyone here do social media with their practice? Facebook, YouTube, Instagram, tic-tac-toe? Anybody on tic-tac-toe? Right? That's what I do. Okay. Who still uses yellow pages? Anybody? Yeah, exactly. If you laugh, you know what I mean. When I came in practice, we had, this is 2001, 2002. When I get in my own practice too. Number one thing back then, yellow pages. I have interns from the RP program locally, the local high school. Even Cal State Fulton comes up to see me. Interns in my office about 3 days a week. I ask them, what's the yellow, have you guys know what yellow pages is? They go, like this, blank stare. No idea, like perfect. So it's this, if you don't know, it's this big book that gave you all the business in your area. And they were monetized by alphabetical order for one, but also how much you wanted to pay to be in the book. In our book, we had someone who worked for Verizon in our office, so she gave us like the deal. We had like the front page ad, it's called the double truck, where you open it up, it's color pages, and double page. Like, whoa, yeah, massive. But at that point, you had to pay for it. Once that started dying down, and that was like, I don't know if you remember, or if you had it before, it was like $1,300 a month. It was huge. It was a huge budget. And even the white pages too was like $500 a month, the smaller book. So part of it is, that's how you advertise. Besides, what's the best way to advertise? Word of mouth, right? It's your best way to advertise. But it takes time to build that up over time, not just time. But once that started dying down, we went, how do we now get people to understand this a different way? To get them here. So we started going to, like Ron was saying, I think it was YouTube first, and then, website first, then YouTube, then Facebook, then Instagram, now tic-tac-toe. Right? So how do we get our patients to understand our message, to get them here, to get them to understand this can help them 100%. Right now we're filming it, we may not use it for one too. How do you help people understand your message by communicating the way you communicate? Is it verbal? Is it through x-rays? Is it through, say, auditory also? Do you have a video in your office that you show the patients walk in the door? Everyone's different. We have a TV screen, we shoot some videos up there too. We've done videos since 2012, I think, for long format YouTube. How do you fix back pain? Here's our long video. How do you exercise? How do you stretch? Where do you get information from? You know? So a lot of it is, can you communicate well with your patients even before they walk in the door, so they have an idea when you get to your office, hey, I want that chiropractic care. I want this chiropractic care. You know, versus they come to the door and go, I want chiropractic. I'm like, you know what it is? I have no idea. I'm like, perfect. I love those patients. At that point, they're fresh and they're open for ideas. So, and we all have stories, right? I tell my patient, my first time I see a patient, I go, and I take x-rays in my office. I'm an old school x-ray guy. I take x-rays in my office. We show them the x-rays compared to normal, all that stuff. You go through some of that stuff if you want to. But a lot of it is, I go into the room, I go, and before you even see them, I'll tell them, if you have a spouse in the room with them before I kind of prep them, and I'll go to them and go, you have 4 different reactions when you have your first adjustment. I always do the neck first, get that neck out of the way first, especially if it's a neck issue. What's the 4 reactions for an adjustment? 4 major reactions. What do you think? What's one? What do you think? Anybody?
Relief.
What's that?
Relief. Wow.
Relief, right. What's your reaction from the relief though, sometimes? What's an emotional reaction?
People go amazing.
Yes. And sometimes I go the major 4 just in more of a comical thing. Laughing, crying, sometimes, speaking in tongues, or Tourette's. I go, what the F was that? So sometimes you have no idea what's going to happen with them, you know? So, and how do you, when they react that way, not have a, oh my God, I didn't expect that reaction? You know? How do you react to make sure they understand that was normal? That's good. That's great. You know? I have someone after I finish adjusting them, I have them stand up and go, how does that feel? They go, they sometimes go different. I go, what's different mean? They go better. What's better mean? So I want them to verbalize also from the adjustment what is actually happening. What do they feel different from? Right? So I had someone come yesterday. Had pain since December. He works up in Big Bear. I adjust him first time. He's about 22 years old, and he goes, man, I got up and now I've got emotion. Yeah, that's what we're hoping for. You want to make sure they're better is what we expect, right? If you go, oh, it feels weird, like, oh man, that's not good. They're like, you're gonna freak out on you. You know? So as a healthcare practitioner, how do we communicate well with our patients to understand this is getting them better by your adjustment? When you adjust somebody, how do you react after you adjust them? Say just for example, neck adjustment. What do you normally do? What I normally do is go, boom, that was great. Boom, that was good. Boom, that was a good release. Good, we unlocked it. So when we do that, at that point they're going, that adjustment, that pop, that pressure release, allow them to go, now correlate that with better, with feeling better, release, clear, whatever you want to use term-wise. When you get your patients to understand certain terminology, this is just human nature per se. They link that with better, healthier, stronger, less pain. We help our patient understand that so we're not just sitting there, boom, 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 boom. Okay, thanks for coming, bye. In school, how much did we learn about communication? Zero, I think, at least when I was in school, back in the fossil days or medieval times, whatever that was. You know, a lot of it is, how many people, when you were in school, found a mentor to help you learn how to practice before you had to practice? How many people did that? Hard, right? You're in school 8 hours a day. You come home, maybe work out, shower, eat, say hi to your spouse, walk the dog real quick, and get the heck to bed. You know, I was lucky enough, fortunate enough. My when I talk to interns and these students that are wanting healthcare, I do a lot of talks for nursing schools, medical schools, high school, college levels. A lot of it is I go, how do you plan for the future before you get to the future? I was lucky enough to take, again, didn't have any internet back then. It was very modern. We had, first computer I learned on was that little Mac. Remember the little Mac? Small one, tiny one, like kind of small screen. That's how I learned the internet. That was mine. But back then, when I took the Yellow Pages, when I was first semester at LECC, or it's called Southern California University of Health Sciences now, Yellow Pages, alumni list in my area, and go, okay, how do I find a doctor I can work with now, because I have 9 semesters to go, and start working with them so they know who I am and learn what practice is really about. Because I heard, and I was told, school is great to pass the boards, hopefully. Get through school, pass the boards, then boom, good luck, right? What does that do for most doctors? After 5 years in practice, they go, I'm out. Is that still the stat? After 5 years of practice, most doctors call it quits. Based on economics, based on what field get into, based on not being able to earn enough income to support their family after 5 years. So how do we get doctors now to understand we have to learn how to practice before we get into practice? I was fortunate enough to work with 2 doctors when I was in school, whenever I could go and volunteer. By the time I graduated, I already had a job lined up ready to go. Yeah, everyone's different. You may have a family member who's a chiropractor, a friend, whatever it might be, but I didn't have anyone. I just wanted to get in the field because I wanted to help people. Back when I was before I started chiropractic school, if you guys went through this too, there is a website called quack.com. Remember that website? It was basically a person that would rip on any profession that was in healthcare to basically, especially chiropractic, we're the worst. We're top 1 or top 2 all the time. It's great. He was like, don't see a chiropractor, they're the worst, they'll rip you off, they'll take your money, they don't know what they're doing. He says, but if you do an examination if you do x-rays, if you communicate well, then I would see a chiropractor. That's why I went to chiropractic school. I thought about dentistry, chiropractic school, I think other little professions here too. My biggest thing with chiropractic school initially was I want to play golf once a week. That was my thing. That was my thing. But I want to make sure I help people too. My parents, as most parents did back in the 80s, they worked 80 hours a week, 60 hours a week. They worked a lot. I want to make sure I can spend time with my family and do that. So if you have a balanced life, good for you. If you don't, sorry. But a lot of it is we find that balance in our life, so again, we can practice a long period of time. Why do some chiropractors, we said before too, why do they quit after 5 years? They call it burnout, right? What's burnout mean? That means they're not happy with the profession, happy with their own personal life. They haven't found a way to get that balance. We can have that balance. If you've been practicing more than 10 years, more than 5 years, you guys are on. You guys found your thing. But can we maintain that a whole life as we go through having kids getting older, going through family stuff, having our parents get older too, taking care of them? We have a life. When someone comes in your office and they start telling about, say, I have a lot of sometimes senior patients, right? If they're over 65, they come on and tell me their story, what their life's like, what happened this week. When they do that, do you tell them your life too? Like, yeah, I had a rough life this week too. You know? No. And again, you might. But when you do that, you're almost going, you're more important than they are. They're not there to see you. I'm sorry. They're there to see you for your help. And a lot of it is when you talk to patients, if you've seen them for a couple of times, we do a lot of this, right? But time-wise, quantity-wise, are we doing more of this or more of this? Sometimes I'm doing more of this. This takes for me, about 2 minutes. Boom, 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 done. Good. But how's your day? I had one guy, actually two family members, Sylvester and Ramon, they're having kids this week, coming up. Okay, how's it going with your wife? And they're having grasping his contractions, right? How's the hospital visits? How's other kids doing? So they're going, I'm worried about their life, not, hey, I had a rough life this week, I had a flat tire, my kidney's oil changed. I don't care about me. They want to hear about their life. When you make it personal like that, but still professional, does that help them want to come back and see you again? Can we adjust more people if you make this personal about them? And someone asked me yesterday too, how do you remember what I did last week? I'm like, I don't know, there's a file cabinet up there. There's something that tells me what to do. When I come to the room and I see this person, I'm like, hey, how's your daughter's graduation last week? How do you know that? I have no idea. It's just in here. But it takes time to get that. When you see someone's name, how do you link their life with that name? So they know when they leave, man, that doctor really knows me. And one guy, Raymond, he says, man, I work with a partner who's a great guy. Been working with him for probably the same thing. I brought him to his practice 20 years ago. He goes, yeah, he talks to me. He goes, no, you actually know what I'm doing. You know my kid's going to this school. You know this is going in my life. Like, I don't know. Because that's important to me to understand. When you do that, when you make it that personal, but so professional, what does that do for that patient? Even on day one. Trust, huge, huge. When you can communicate well with that patient, you can build that trust to help them understand they can trust you with their problem. They may not get the adjustment, they may not get the quick 100% relief the first day, but they know you're going to help them. You're going to know when you build that trust, communication, at that point allows them to see that. And we all do this too. We see a patient, you look them in the eye, hey, how you doing? I'm Dr. So-and-so. I'm here to help you. We all do that, right? That's part of the business of what we do. Look, as I work with sometimes younger doctors too, it's doing it with confidence. And this, you guys all have, this is easy for you guys. But giving that time to build that confidence up so it's done sincerely and with a personal touch. Everyone's different. You guys have your own jokes. You know, I have my own jokes. Sometimes you get, sometimes you're, not so good. You know? Sometimes, you ever address the patient and go, when you're checking them out and then checking them out and feeling out their spine, and you go like, oh, it looks like that might be a tumor. Did you ever do that? You know? I do it after maybe the third or fourth minutes when I get that couple chuckles in there. When they get who I am, they go, Doc, are you serious? Like, of course not. Come on. Like, but we should probably check it out. Just in case. No. But that's something you have to be able to read it. What's it called? You guys know who Paul Rudd is? Paul Rudd? He's a funny, quirky guy, actor. It's called about, sometimes he does it purposely. It's sometimes he doesn't read the room properly. Like you walk into like a funeral and go, oh, what's the party afterwards? People are like, no, we're talking about the funeral right now. You know? So how do you read the room properly so you have that consistent, when you end someone's care, say you walk them out of the room or you put them on, I put them on our stabilizer table afterwards, they leave like, man, I enjoyed my visit today. And sometimes you ever have a patient where you take an X-ray examination, like you're not in the right place. You have either a fracture or something else going on. The red flag goes off in your head. You guys ever have that? You go, this may not be for you. Let's wait a visit. Let's kind of see you take your back to medical doctor, see what's going on. Or they come in even with a problem. I've had someone come in with cancer before. Can you still adjust my mid back with cancer? I'm like, no, I can't. Sorry. But how do you let them leave with, hey, at least the doctor helped me with something? I've had patients in practice long enough. I adjust them a week or so, or maybe 2 weeks. Not getting better, send them out, and they need surgery. Done. Not in the right office. I tell my patients, if you're at a 9-10 pain level, I'll give you a week and a half, not see improvement. It's time for an MRI, time to get maybe see an ortho, maybe see a surgeon. I'll call them afterwards, go, hey, sorry about your diagnosis, you need surgery. I'm thinking, hey, but you did, they'll let me know, hey, you tried your best. You led in the right direction. I would have waited longer to see a doctor, get an MRI done if I hadn't seen you first. That's all we're hoping for, right? We help people understand they're part of their care, wherever that might be. I think that's the important part of being a chiropractor. They come in sometimes, especially now, because their medical appointment with their doctor for their back pain is how long? You think, is there a doctor appointment with their physician if they have health insurance tomorrow? Maybe next day? No, 3-4 weeks out. Like, I have back pain now. We'll go. What's the health insurance's answer? We'll go to the emergency room. Go wait 4 hours in the emergency room. Who wants to do that? Nobody. Unless you really have to. If you have like heart issues, like yeah, ready to go. But if you have a back pain or neck pain, emergency room, urgent care, or they've done this already too. Medications. Doctor medication I'm working. We'll send you to an ortho, and that's not 2 weeks out. Sorry, that's going to be 8 weeks out. 6 weeks out, 4 weeks out. Who wants to wait in bed? They can't work, they can't take care of their family because they're in pain. Nobody. So we help them. They called yesterday and go, hey, look, I have a spot today. Next day for 1, 2, 3 o'clock. I'll see 3 o'clock. Like, wow, I can see that doctor at 3 o'clock. They're looking for help, immediate help. We help them at least get the proper diagnosis, and that point for us and for them communicate well, that they can actually get that to better over time. And if you guys, I don't know if you guys do this or not, I treat the same day. I want to take their x-rays, get them on the table, get their initial treatment done right away. So they feel that they're in the right place, right? That's what we're hoping for. Can we help them know you're in the right place, getting the right help? I think when we do that, what happens to the patient's anxiety, their fear, if it's gone so far even to depression, gets a little bit better. That anxiety decreases. Their fear decreases. Their hope increases. That's what I want to do. That's my first visit. We can get that experience with that patient, I think, as you guys know already, allows them to go, okay, I don't need surgery. I don't need this. I can come here and get the help. That point, we can get more of this done, with adjustments done, to help them improve their overall life. Any questions so far? I see a lot of like this because we all do this already. If you practice long enough, I think a lot of it is you're going to get so different reactions. Who's ever been punched before from an adjustment? Anybody else? Yes. You know, it's going to happen. I adjusted someone, she worked for security for high school, a really rough high school. Just her neck seated, boom, she popped me in the jaw. I'm like, wow, I've never had that happen before. Wow. She's like, I'm so sorry. It's just her reaction. Like, okay, I learned from that mistake. I've learned, I adjust someone and get out of the way. Jab and then go. Jab and then block. Jab and then go. So you have to be able to, as we practice, it's funny, even when it happens. Funny. I always tell people, I'll play golf and things will happen all the time too, or things will happen in the office or anywhere. I go, always, my first reaction is always, can I laugh now? Or do I have to wait to laugh later? So can we have enough of if you want to call it I call it funny bone, to go, whatever's happening, wow, that's great, I learned something. What to do, what not to do. I had someone come in only a few months ago, he played high school football, D1 football, a lot of concussions. He is 42 years old, nonverbal, Alzheimer's. His wife is his I guess she runs everything in what he does. So I addressed him first time, and he's like, ugh. I'm like, is he okay? He's a big guy. I don't know if you ever know a player called Eddie George. He's a big guy. And he was, Justin, is he okay? I was like, you'd be okay. I'm like, okay. Just his other side of his neck. And he jumps up and makes his fist and does this. I'm like, oh no. And I'm in the corner. I'm like, I can't go anywhere. I can't get out of here. So she steps between us and goes, oh, he'll be okay. I'm like, all right, I think we're done for the day. That's all he needs. He's good. So she goes, well, next time he comes out, give him another prednisone, the second one, and he'll be okay. I'm like, we'll see. So how do we, again, it was funny within probably like a minute once I got out of the room where it was safe to get things going. But a lot of it, we're going to have, as you go through patients, again, everyone's reaction is different, right? Nobody knows someone's first reaction to an adjustment. Nobody knows. I had a guy actually who was on the State Farm commercial a few months ago, a big guy, he ripped his shirt off, State Farm commercial with Mahomes, and I adjusted his wife, his thumb both, took actually his first, adjusted his wife's first in the room, he runs out. This guy is 6'5", he fits like a normal door, a normal height door, he has to duck down a little bit, and is as wide as a door. He runs out of the room, takes off. I'm like, what is your husband's problem? He is deathly afraid. First adjustment for both of them. So I go, can I videotape him? He's like, of course you can. I videotape him, I adjust his neck, scream, mid-back, scream, low back, scream even louder, like I was stabbing him with a knife. Great YouTube video, great video on Facebook, great video on Instagram. Good, and really, and I didn't find later he was an actor until later. But he wasn't acting, he was like, it was scary to him. Big kid. He has a great Instagram following and everything too. But you're not gonna know until you do the first adjustment what's gonna happen. So can you read the signs, sometimes as we know, when they're nervous, when they're excited, when they have no idea what's gonna happen. When they're nervous, what do you normally do? What can you do to help calm them down when they're nervous? What do you think? What's a good thing you could say? What do you think? I say, hey, I've done this for 23 years. I've never hurt anyone before. I'm going to be very careful. I'm going to help you breathe through this and take it very light with you. So at that point, you'll get comfortable over time. If I know the patient and I know the patient's family, whatever it is, instead of that, I'm going to say, I have good malpractice. You're covered if anything happens. Right? We all have good malpractice. Use it once in a while if you need to. At that point, again, if I know the person, read the room, people. So if we make them comfortable so we actually feel that overall they can get the experience of the adjustment, and at that point walk away and go, okay, this is what I need. Anyone have an experience where someone does not want the neck adjusted? Deathly afraid, right? I'm like, but their problem is where? In their neck. So I'll do a stretch, I'll do little things here and there to get them comfortable. Go, hey, I'm gonna go, if you're okay with it, I just say, if you're okay, I'm gonna go a little bit further, you may hear a little click, is that okay? Then go, all right. And get just like, wow, that's all it is? I'm like, yeah, I didn't break your neck, did I? Well, as far as you know, I didn't break your neck. So a lot of it is, they just don't know. Or they watch the videos online that says, if they adjust your neck, you're gonna break your neck, you're gonna stroke out. You're gonna be paralyzed the rest of your life. What's the chance of being paralyzed by an adjustment? What do you think? What's the stats say? It's like 100? 1 in 10? No! 1 in 10 million. Is there a better chance of falling out of a plane accidentally? Unless you're doing like, what's it called? Well, you do it intentionally. Skydiving. I did that once with a guy that when I did it with him one time, I checked his mental side, little psych tests. Like, are you okay today? Any suicidal thoughts? Nothing? You're gonna pull the cord, right? You can pull the cord? Good. But a lot of it is, can we do enough to where we make them comfortable, and at that point we feel that overall benefit? I think that's the overall. But I was gonna say one thing too. I have so many stories of patients. You ever have a patient come in your office, and especially if they're say a mom or mom to be, and then come out, especially with a full waiting room, and go, hey, you may be pregnant. Ever get that? It's like, oh, back up. So I've helped your back get better to get pregnant. Oh yeah, that's what I meant. And we're like, what the heck is going on? So we have to be able to, read the room, understand how to make not only that person comfortable, but that person over there comfortable too. When someone walks in your office, most people have staff. If they don't, that's okay. What's the biggest thing you want to make sure what's going to happen when they walk in the office? You're going to have a good first impression, right? With your staff, with your office facility, with even you for the first person too. I have 2 staff work part-time. Office manager's been there forever, Bon. She's been there before I was there. She runs the show, likes 3 people. A lot of it is you want to make sure that staff or that person knows what's important to them. What's the most important thing for every person and everybody? What's the most important word for them? What are they going to recognize? What's going to be the thing that they're going to recognize the most? Their name. Boom. Someone read that book, whatever that book that is. I think it's Dale Carnegie's book. Their name. So when you walk in the door, they don't see patient. Hi, Johnny. How are you doing today? Welcome to our office. They go, wow. All right. Versus behind as you go to medical doctor sometimes, you're in the hospital to urgent care, there's a piece of glass, someone you sign the name, and then you sit down, and so they call you 5 minutes later. My staff know, come around the corner, give them the paperwork, patient paperwork, right there, sit down with them. Any questions from this, please let us know. What they do also too, if they're comfortable, everyone's different. I am. Put their hand on their shoulder. Put your hand on someone's shoulder, what does that tell them? Gives them comfort. Again, be appropriate, right? Whatever words it is, be appropriate. Gives, hey, welcome to the office, hope we can help you. Well, look them in the eye, obviously, all that stuff too. But that allows them to feel that you're helping them. Most doctors, do most doctors touch patients? Medical doctors, nurses, things like that? Unless they have to, minimally. Because we're different, we have 2 different letters after our name, we use that to let people know we're hands-on. We want to use that touch to give you comfort. Is that right? That help you guys? I mean, that helps me understand my patients better when they leave, especially some of my senior patients. They just want someone to kind of show them what's going on. They want to see that they're being helped, or if anything, being taken care of. I have Stephanie comes in, she came with bad back pain about a month ago. She goes, I come here because you listen to me. I come here because you understand, you're my doctor. I want you to show me what I'm doing right or wrong. Most doctors won't. And with most senior, when you have senior patients, what's your number 1 goal with a senior patient? Number 1 goal, every senior patient. Seniors mean like over 65, over 60. For me, I'm 50, so I'm like, I got this last month. I got my letter saying, welcome to the 50s, ARP. I don't know what that is. That's pre-Medicare. It's pre-senior status. Like, oh, thanks, guys. Appreciate it. I got a free tote, though. I got a free tote. I'm happy. My tote. I put it in the car today. Or last night, actually. But with over 65, 60, what's your number 1 goal? I do a workshop with seniors every month. I see a lot of them for one, too. They want to stay mobile. They want to stay independent. Can you help them do that? They want to stay independent. So can you make them feel better with the adjustment? Yes. But after the adjustment, what's a good thing to do with them? How do you walk? What causes pain from this adjustment? What are you trying to get rid of? You may do it before the adjustment too, but how do you help them become more mobile, less pain? At that point, get them to where they can stay mobile outside their office over time. I brought these, I got them yesterday in the mail, I got some ones at the office too. Have you ever used bands with your patients? Simple things. You can give them away if you want. I don't, because I'm going to charge them like $1,000 for this stuff. A lot of money. But can you help them do one thing with them? I do water bottles. I'll have them show a video. I'll send videos to my patients too. At that point, they know after the adjustment, I'm going to get videos on how to stretch my shoulder, how to move things around, how to get my back to stretch itself too. Using a band for ankles, for knees, for hips, for one too. Can you do little things in and outside the office to help your patients feel better? When they leave, a lot of my reviews from my office, because I want to get that feedback from them, is the adjustment was great, but the doctors gave me exercise afterwards to help me at home to get better for my next adjustment. And does it help you with more compliance with the adjustment when you go, when I see you in a couple days, if that feels good to you, I'm gonna give you more exercises to do, more stretches to do. Because some people have no idea how to work out. When they come in your office for their first chiropractic treatment, what's been going on for a long time, you think? Their body's been building, especially if it's non-traumatic pain, not a car accident, nothing traumatic. They woke up, they brushed their teeth, and then went, oh crap, what happened to my back? Like, oh my gosh. Ever had that before? Instant pain. No reason, never had a back problem before. If you take an x-ray, it's okay, it's not horrible. But they're gonna go, now what do I do? The problem is they've been doing, especially with COVID, at that point they've been doing this all day. Here, on the computer. And instead of their work chair, maybe they're like this whole time. This, as you know, we already know this bad posture, whatever it is for them, at that point has caused them to eventually build up that pressure to cause that pain to happen. It wasn't the toothbrush, it wasn't any toothpaste you used, it was actually your position, then it hit you. So we can get our patient to understand, can we change someone's posture? I can do this all day long. At that point, get back to here over time, once you communicate that well, to make that pain stay away. And for me, my circling back is the adjustment will help get things going and get things to loosen up. But it's going to be your job to make sure you stretch enough and do your exercise at home to make sure it stays this way. I'm going to see you for these amount of weeks, days, whatever it is too. But I want to make sure you understand, I'm only going to be here for you for about maybe 10 minutes a day. Maybe a couple days a week, maybe 3 days a week, whatever it is too. But can we over time realize for them, they're their best doctor, right? You're teaching them how to stay healthy, not just adjustment, boom, I'll see you next time. I think, that's just me. Can we have better patient clients have more adjustments in your office because you're giving them enough information to want to come back? You guys see that? And is that sales or is that marketing? What do you think? Both. I go, it's more marketing because you're giving them an education versus, hey, I have a special for $29.95 on Thursdays through Sunday. Come and see me. Yay, hi. Here's my location. No. So it's you being educational to help that patient understand, I'm here to help you better your health, not just take away the pain today. So you have a patient, I'm going to call it for life, because you know where to go when that pain comes back again. You're teaching them long-term to take care of their body. But what happens? Life. They sit in a car and drive during a holiday 4 or 5 hours somewhere. They go crazy. They try to build a block wall in the backyard when they have a desk job over the long weekend. Who gets phone calls on like a Monday where like, my back's killing, what do you do? I did this, like, you don't ever do that. What are you thinking? You know, come on, that's like what you do. But my friend needed help, blah, blah, blah. I give my patients, I'm gonna add my cards. I give my patients on my card, has my cell phone number on the back of my card. Has my cell phone, my personal cell phone number. How many people call me a week, you think? 0. Why do I do that? Why would I put my cell phone number, my name out there on my card? What do you think? To give them that comfort level they can reach me anytime. But there's only some that are a little bit off sometimes. Get a patient that's a little bit off, and they start like, oh, I just want to let you know my day went. I'm like, no, this is not the number it's for. It's if an emergency you need me. So sometimes on a long weekend, like this weekend coming up, I think we have 40 weekend for some people have kids, whatever it is I had a phone call on a Monday. Hey doc, I did something dumb. I tried to do a black diamond skiing. I've never done that before. My friend talked me into it, and I hurt my back. I'll go perfect, and I'll judge and call it. Should I see? Because I'm down the street from my office and down the street. Should I go see them right away, or should I wait till Monday? And usually, as you guys know, they just want to hear you can help them. I go, hey, did you fall? Does it hurt all the time? No, it hurts when I move, or when I move a little bit here and there. It's a little bit of a pinch, but I'm okay. Okay, perfect. I'll see you Monday. Boom, done. Phone call. What does it cost for the phone call? 2 minutes of your time. Instead of the person with the emergency room being told in the emergency room, hey, don't see a chiropractor, chiropractor's gonna probably make it worse. You lose, not saying lose the patient, but then you have someone in their head talking negatively about your practice for you. At that point, you avoid that conversation. I had a guy come in, young guy, he works at UPS. probably about a couple years ago. Comes in Monday, gets adjusted, and he's upset. I'm like, why are you upset? Because he goes, I forgot I had your number, went to the ER, spent 4 hours there, got nothing done. I came here for 10 minutes and I feel 100% better. I'm like, I'm so sorry. I'm like, ha ha. Good for me, good for me. So can we give our patients that comfort level? And you may be not comfortable, that's fine. But the way to reach you, even if it's through Yelp or through Google, we do all that stuff. Everything goes to my phone. I put notifications all the time. Hey, quick message, can I see you tomorrow? Hey, can I make an appointment? And I just kind of walk through, who are you? I'll send my number to your staff. I'm out of town right now or out in the office. At that point, the way to communicate with you, to give them that comfort level that they can actually not have to go to the ER, not have to go to the emergency room. And just avoid that stress of doing it. Some people here worry about reviews. Not worried about like, are they helpful for some people? For me, it's more feedback, like I said a second ago. It's feedback of what's going on in your office and how things actually work properly. I had someone give me a review. He had a bad adjustment and he had a long review. He didn't want x-rays, he took the x-rays anyways. Doctor did this, doctor did this. And I found it's the same name of the office, but it's in like Nebraska. I'm like, and I got it on a Sunday, which was perfect. So I messaged him right back. I screenshot the review. I think it was on Google, my video. Screenshot the review, and I messaged back, hey, I think I got the wrong office, and also deleted the review right away. Deleted it. Perfect, right? The biggest thing I did to use it for my staff, my partner, and I had 3 staff back then too, was going to be, okay guys, we have our meetings on Monday. And I go, okay guys, we got a bad review. They go, no way, not going to happen, no. And they go, nope, it happened. I just sat there, let them kind of like steam up a little bit, get mad at it. Who was it? I'm like, I won't tell you till lunchtime, or meeting at lunchtime. And I go, I'd rather be like, that's not us. I'm like, it's not us, but it could have been us. Who's in charge of your reputation at your office? Is it just you? Or are there people in your office, your staff, that can help or hurt your reputation? So we have to worry about that. I want to say worry, but be aware of that all the time. I have people, because I have reviews of social media stuff, that always, every month I'll get at least 1 or 2 people wanting me to help them with the marketing. Yeah, if you get those emails, I'll give you 30 patients in 30 days or no cost to you or something. Right? That I go, well, why? Now, sometimes I'll answer their call, put them on hold, and go, they'll ask me, how do you have so many good 5-star reviews? For Yelp, for Google, I think for Facebook too. My #1 response is, I know where they live. Right? These are patients yours. And it's a joke, I know where they live. But at that point, I want to make sure everyone's experience in my office is going to be as good as possible for that day. And again, your staff is just as important, right? If someone calls your office for the first time, never been in your office before too, and your staff is rude to them, condescending, or laughs especially, what happens to that patient? They're going to be steaming, upset, and mad. I've had a couple reviews like that with my staff because she gets, sometimes previous staff gets, I guess, anxious or they start laughing like, don't ever do that again. So don't do that because that hurts your reputation. Everyone in your office, even your social media, affects your reputation. So if you do social media, like I've done in the past on and off, or I do now, but had people question what I put out there, it has to be, you got to think of when you put something out there or respond to something, even reply to someone's, say, post or whatever it is too, is that going to come back and haunt you? Everyone has their own personal religious beliefs and their life beliefs, whatever it is there. Can you keep that to yourself? Because realize if you work in a community, as you guys know, at that point it's going to affect your patient community. Maybe today, maybe tomorrow, maybe next week. We have to make sure we are helping to help ourselves get better. And I brought some wipes too.
Okay.
So question for you guys. How many people do the actual physical adjustments? Most people do, some people don't. Okay. When you adjust someone, do you do it face up, face down? Do you have a preference? The patient has a preference. I do mine face up sometimes, face down, and also seated too for the neck. That's my biggest thing, especially for headaches for one. So how safe is the adjustment, you think? We talked about a second ago, percentages wise. How do you rule things out to make in your head, there's no red flags, to make sure that the person is safe to get adjusted? How do you do that? What questions can you ask someone, or paperwork-wise? I like the paperwork, yeah, whatever, but I want to hear from their voice. Have they had a previous stroke? Previous trauma in the area that's causing pain right now? Previous fall, previous injuries? If they had those things, the previous trauma, have they had x-rays before? What have they done? What in your head can you ask questions about to rule out something that may be a risk factor for their adjustment? Have they had previous blood pressure issues before? And reasons why? Have they had heart surgery, any other surgeries in their body for one? Have they had any injuries to your shoulder or clavicle that could cause a carotid artery to become calcified? When you adjust their neck, it can cause problems. You know? How many people have ever adjusted someone's neck and they have a headache afterwards? I have. Many, many, many times. How do you explain that? What I say, this is my own thing, is I'll say, because the nerves in your neck have caused, I take an x-ray, have caused that carotid sinus, which is your thermostat to your head, from your body, that cause problems, it's when you have a stressed carotid sinus, it's causing to constrict the area, causing less blood flow. So what happens when I release that pressure on that nerve, now that carotid sinus can now relax, and now can it relax to add more blood flow, it's going to go to your head, so that pressure change in your head will actually make you feel a little bit of a headache sometimes, a little bit of head pressure, then it'll dissipate and become more equalized, more balanced out. They go, okay, doc, I'm not having a stroke. I'm like, you might be, but not this time. You know? So you gotta read the room, right? You gotta read the room. At that point, you gotta go, okay, why am I having this? Because of that. Ever have a patient fall asleep on you? Fall asleep after adjustment? I did first time when I was first in practice, and it freaked me out. I'm like, oh crap. I was checking, malpractice set up. Okay, I'm good to go. I had someone adjusted. It was in the morning. A new mom. She had a kid, a new kid. Husband came with her too. When I adjusted her, and she sent her home with an ice pack, and she was doing pretty good. She was able to, and the biggest thing, she couldn't sleep. Because of her new baby, complications with the labor, she couldn't sleep very well. Probably about 4 or 5 days. I sent her home after adjustment. She goes home, and she falls asleep right away, and her husband can't wake her up. She calls me and goes, I can't wake my wife up. I'm like, crap. So I asked her, is she breathing? He goes, let me go check. He takes forever too. I'm like, come on, I'm on hold here. Let's go. So he goes, yeah, she's breathing. Well, when you try to wake her up, what happens? She goes, Then she's alive, let her sleep. And don't freak me out. You know? So you have to be able to like, give yourself a second and go, that's normal. Yep, that's normal. She's trying to get her rest now. She can actually sleep. Her body's relaxed now. The pain's reduced enough so she can actually sleep. He goes, okay. You dad. He's tired too. We have to be able to read the room, right? I had someone come in a couple weeks ago, Sheila, real good lady. She comes in after first adjustment, she had bad back pain, desk job, and she goes, I'm concerned. After first, I'm like, crap, what's concerned mean? She goes, I have no more pain. I'm like, well, good. Use the right terminology, people. Everyone, and as you know, this is 2024, right? People use different words for different terminology. So can you ask for clarification what that means before you jump to your conclusion what that word or that term means? There's so much different lingo out there now. Again, I'm 50 years old, fossil. At that point, where you have to almost go, what does that mean to you? What is that? What are you trying to say here? In a courteous way. You know? So everyone's response is different. They use different terminology. They have different things that they think might be. How do you interpret it to make sure that that's going to be good in the long run? I think. I have so many stories. It just, as Moon Practice does, you guys know, you're like, wow, that was a fun day. You know, that was a good day. Something happens like sometimes like not so good. I'm like, ugh. Like, and then I laugh afterwards. My wife goes, why do you laugh? Like, because it's funny. No one died. We're getting injured. We're good. You know? With the adjustments, does everyone here practice solo? Solo practice? If you want to get adjusted, please let me know. At that point, we can always do that too. We can't, it's never required, ever. But do you guys, what's practice solo? Do you guys want to get adjusted? Come back, sir. We don't know? Okay? Be my guinea pig. Oh, sorry, not guinea pig, my model. I'm using the wrong terminology. See? Dang. So, grab the seat. Yeah, don't you hate that when people don't empty the pockets when you go to your office? You know, I go room to room, grab a seat. What's your name?
Make a lot of money that way.
Tony. Dave, grab a seat. Don't empty the pockets at the table. I put for a new office. I put tables up there. Little corner tables, like corner table, stuff over there, please. Like, oh, your glass too, yes. Because you adjust on the side, right? Keys go into the hip, they go, ow. So I have to go, oh crap, what did I do? No, because your keys hit their side of their hip and cause a little bruise. All right. So Dave, what's going on?
Upper mid back.
Cool. You're an active guy. You're a healthy guy. Good. What makes your upper back tight normally?
I do a lot of soft tissue work.
Ooh, so a lot of arms, hands, shoulders too, right? How's the shoulders feel?
Extremely.
Tight.
This one's fun.
Good. Did it increase interest to your shoulder? Good. How does that affect your neck from the shoulder? That complex.
Yeah, really much.
Good. So some people have, as you know, from when they have that shoulder pain, goes to the neck, goes back to the upper back, also causing all that pressure. You ever have your shoulders adjusted too? I saw it on YouTube. I'm gonna adjust you. I tried on you today. Is that okay? I'm kidding. Okay if I adjust your neck seated?
Sure.
Perfect. Again, saw it on YouTube. Figured try to do first. So here, David, as you know, we just feel around, right? I always tell people too, as we have been, bring your body up a little bit, get that posture up, get them reset. Perfect. That's when you, it's like working out, right? When you work out, have some workouts. You want to work out here, or do you want to work out here? So I want people to work out here. I want them to also get adjusted here, so they know what normal posture should be over time. Right here. So David, right here. I'm gonna get right in the one spot, and again, it's not a tumor. Just a little bit of pressure. Your head bend a little bit. Take a deep breath in, all the way out. Right there. Is that okay? It's been a while, my friend.
Been like too long.
And I think a lot of this practice, especially for solo too, and it's hard to find a chiropractor locally that will do the equal exchange, right? That's the plan. We'll go this side too. Do you guys usually adjust both sides or just one side? You go, oh, I'm good. What do you guys think? I adjust both sides and I tell them, I don't want them to walk in a circle. I want to make sure they're staying even the whole time. All right? And then sometimes you'll check and nothing will happen. I want to make sure we get things going. Right here too. Again, if someone has pain, you ever have this? If someone has, for example, pain or tightness in their shoulder, neck down here, what is the common area to have problems on the other side? What's the balancing point? I call it the balancing point. The top of that neck on the other side. So if there's problems usually lower here, I'll see where the body wants to stay balanced. It'll be the opposite side on the higher area. More like say if it's say C6, C7 on the right side, the left side would be more maybe C1, C2, right up here. All right, that's just my watch vibrating. Not your neck, David. Not your neck. Right here. Okay, Mr. David, let your head turn a little bit. Take a deep breath in, all the way out. Right there. Simple. Yeah, you're a do, my friend. When I say, this is things I do all the time, David. When I say you were a do, what does that mean to the patient? All right, I'm at the right place. Patient I've seen him for a long time, like, dude, you've been here for a couple weeks, what the heck, what's wrong with you? See me more often, you know? So I'm setting them up to make sure they understand this was, not only is this a problem, but also it's been building up over time. I don't let that happen again. So I'm gonna do now your shoulders for you. I always do the better side first so they get to feel what's going on. And if you ever do a shoulder, I only started doing this a couple months ago, or actually about a year ago. So David, what happened during COVID? What happened during COVID? How did we communicate less during COVID? What did we do? We had to do, some people did, I admire that they required it. You had to wear a mask, right? If you didn't, when you start wearing a mask, I realized I lost communication skills because they couldn't see my mouth. So what I started doing is go, David, if I'm going to do an adjustment in your shoulder, what I want you to do is bring your left hand to your left ear just like that. So do that for me. Good. I'm going to bring your elbow in when I go behind you, okay? We're going to go right here. So you can see me. I want them they can see me what I'm doing, not just hear me. Right here, bring your elbow in. And here, take a deep breath in. All the way out. Right there. And also back here too. Does that feel okay? Good little AC adjustment. Good. All right. Now let's do this side. So bring your hand to your ear. Elbow in.
Bring that shoulder back a little bit more. Deep breath in. All the way, let the shoulder relax. Right there. And also back here too. There we go. Is that okay?
Just work, my friend. Just work. What I do from here, I'm gonna have you go on your back for me.
Face up.
Actually face up, yes. Important, very good, David. Maybe I trained you before, man. I'll leave that there for you. Scoot up more. What happens when you tell someone to lay down? What happens? And you go face up or face down. What happens? That's next. They're angry out there. What happens is they're gonna do what they feel they want to do, right? So what I do sometimes, I'll tell someone to go face up on your back. I'm being redundant, correct? But they may know face up. They go, what the heck's that mean? Or they go on your back. Okay, I know what that means. So you never know. And still, 8 out of 10 times you still do what they want to do. But can you get them to, initially, so you're not wasting time, I saw wasting time, make sure they're going the right way for you. Everyone's different. So what I do, I always double check the neck, and I'll say, this is me. I'll go, because I'm not expecting any cavitation, and sometimes people come in expecting the adjustment, the pop, boom, right? I'm going to adjust them, but I'm going to go, I always I'm just going to double check your neck, make sure it's clear, okay? Good? Just to make sure. Right here, take a deep breath in. All the way out. Right there. Good, that's clear. Other side too. Take a deep breath in. Boom, that's clear too. Good, David, perfect. And again, this is how I think about what I'm saying is good, David, perfect. What does that do? It's what I expected. Not like, oh, David, we missed something. I don't know what's gonna happen. I don't know. I had someone and this is just a side note. I had someone come and change my water heater. I was for 20 years, water heater's dead. Comes out and goes, and changes it out and starts trying to turn on and he starts trying to turn it and ignite the water heater. He goes, oh man, that's not good. I'm like, Mike, that's not how you respond to someone. It wasn't a chiropractor. I'm like, Mike, don't do that. You're scaring people. He's like, I'm just gonna change out. I'm like, yeah, do that, but don't do that emotional attachment to you're not working properly. So now, I do and everyone's different. I do mine face up mostly in the sense where I put my hand in the back, you probably just do. At that point, get that cavitation that way. Real simple, right? So Mike, cross your arms for me. Right there, perfect. And this is a good shoulder, correct?
Yes.
You ever have people with a shoulder problem, they don't tell you? They've got to tell you, like, oh yeah, I tore my shoulder before. Hurts a lot. I'm like, thanks, buddy. When you do this adjustment, the only problem with this adjustment that I found is if they have a bad shoulder, you want to make sure their top arm is where your leverage is going to be when you do this adjustment. I have Karen, she's had a bad shoulder for a long time, hers is left shoulder. And I tell Karen, every time you come in, remind me about your shoulder. So if I mess up and miss the wrong shoulder, it's not my fault, it's your fault, Karen. You know, it's your fault. So here, I'm gonna use David's left shoulder, and then David, take a deep breath in, all the way up, good. Take a deep breath in, all the way up. And then take a deep breath in, all the way up. Let's do one more just to make sure we got everything. Let your arm come back. There you go, good. And then how's the lower back, David?
Tight.
Good. Do you feel like one leg is off more than the other? One hip's off? Is it tighter on one side more than the other side? Is it basic even?
I think it's even.
Yeah, mine's usually the right side, especially when I'm working out for one too. So here, and everyone's different with this. If you don't take x-rays, sometimes I use this instead. I'll check leg length. What does leg length do? For the patient, what does leg length do for the patient? It shows you're examining them a little bit more than you would just by adjusting them. So my leg length check for me, I'll confirm with x-rays too, David, like myself, has a higher left than a lower right. So David, what that tells me, when I do this check, is that right now your left hip here, you can see that, David, is coming up, and your right side is coming down. The problem with that, when your left side is coming up, right's coming down, at that point, your body's gonna twist to the right, but the problem is you're not gonna stay to the right because it's gonna look weird if I'm looking to the right the whole time. I'm gonna walk weird also. My upper body's gonna naturally come back to center, causing sometimes more pain in your lower back. That make sense? It sounds good, right? As long as you sound good, you're gonna buy it. Right? I go. Did I say it's gonna cause, when I do this, Did I say it's going to cause left-sided pain or right-sided pain? Did I say that? No, because I don't know. But whatever pain they're having is going to be the pain that's going to help correct that. And as we all know, that left side nerve can transfer over to the right side, cross over, so it can be the other side too. And not for me, 9 out of 10 times, probably 8 out of 10 times, it's going to be the lower side causing pain. Basically, that neuropathy too, correct? Sciatica. Sometimes the same side. Sometimes I remember, sometimes I won't, because it might be their 9th, 10th visit. I don't know. But I want to make sure I confirm with that every time. A quick check, boom, that's your hip right there, boom, 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 and you go. So right when we have you do, Dave, what I like to do is use the higher side. First, can I go on your side facing this way for me? Real simple. And this doesn't raise, so sorry about that. A little bit more toward me. I want to make sure when I adjust someone for the 80th time in one day, my back is going to be good, right? Okay? I always do. I always put my leg on the table. When I do this, what's happening? What am I saving? Here, right? My back, when I'm doing this, helping David come over, my back's going, why are you doing that? Stop doing that. So I do this, and my back goes, thank you. Now all the tension is here on my leg, on the table. I can do this all day long and not feel my back wear itself out. Yes, I'll admit, I go home and take a power nap at lunch. I love power naps. Anybody else? Power naps? Boom, boom. Good power naps. So from here, what I'm going to have you do is bring your shoulder back for me. And I'm going to have you do a little different. I'm going to have you bring that leg off the table into the floor. Okay? And I want that foot to touch the floor because you're flexible. You take yoga today? No? Okay, you missed yoga. So here, when I'm here, what's happening? Knee is on the table, back is safe. If I can roll David over as much as I can push with my hand straight down, not do this where I'm over here. Here, hamstring, glute, back. Now my arm is here. When my arm is here, my elbow is out to where it can cause more elbow and hand and wrist pain. So I come here, David's foot's on the floor. That's my goal. Come here, I do hand contact or elbow. It's up to you. I do the hand first. Take a deep breath in, all the way up. Good right there. Good right there. Good. Other side for me too. So I do 2 moves, hand and elbow. I'm showing you this side easier to see. To help them understand, and bring that shoulder back more. There we go. That leg drop again for me to the floor as much as you can. Here. There we go. And sometimes, as you know, when you stretch someone, you can hear a pop, right? I go, that's great. That's our first one. I go, that's the first time there's going to be more, right? So here, hand contact, elbow straight down, my knee on the table. Take a deep breath in, David. Your head relax all the way. There we go. And move with the elbow. Boom. There we go. Okay, on your back all the way. On your back, on your back. Do you guys, when you do the leg length check, do you ever double check? Sometimes I don't. Good, better, even, good. Better, better. When I adjust lower back for length and equality, I want to make sure the higher side here, Dave can see too, the higher side here, I want to make sure I'm pushing that hip down and that hip up. You guys have your own contacts you guys want to do, but can you visualize if this is here, how do we adjust that to get it better? Because it's not just for someone's back pain or cavitation or tightness. What does that help when you check their leg length or see an x-ray and see if someone's even antalgic too? What is that? When you can adjust them, what can that help? That can help reduce the nerve pain almost immediately. You ever have someone who's in severe pain, you adjust them, it goes from a 9 to like a 5? Yeah. You know? At that point, how do you communicate with them when it goes from a 9 to a 5? They get up and go, man, it feels so much better. What do you normally say? Well, how can you word that to give them why that happened? For me, and I say it so many different ways, so it's hard to give you one thing I say. You took the pressure off the joint. At that point, the joint pressure decreased. That disc PSI that was swollen, causing herniation or bulge, causing your sciatica, now that PSI went from, say, a 90 to a 50, less pressure. At that point, that nerve isn't being affected. That nerve relaxes and muscle relaxes. I said nerve relax, muscle relax. That's why it's instantaneous improvement. I said if it was a muscle problem, David, we'd have to do massage, we'd have to do physical therapy, we'd have to do stretching, get the muscle release. Nerve pressure release, automatic muscle release. That's where you feel the pain. And everyone's different. I do hand stuff, I do pops, I do head touching, nose touching for 1, 2, so they can hear and see it. What helps me helps them see it too. And when I do this too, especially if you're sitting up or standing, when I'm done talking, I always do this. When you nod with someone, when you're talking to someone, what does that make them do? It makes them nod also. When they nod, from you nodding, that helps them confirm, I get it. They go, I understand. I had a son who was his first job interview, Barnes & Noble. I go, what are you going to do? He's like, what are you going to do? How are you going to dress? You're dress appropriate, right? We're calling shirt, pants, and leather shoes. But I said, when you talk to them, they ask you questions, how are you going to talk to them? How are you going to respond to their questions? I said, do this. Just give them a little bit of nod when you answer the question. And he said, hey, it worked. I'm like, of course it worked. It's psychological. Can you get them to understand what you're trying to help them with? So not only today, but next time they know what to expect. They want to come back. They want to do more adjustments with them so their problem gets better and stays better. So teaching the right things get done. Knee, ankle issues?
No.
You ever have your ankles popped?
Yeah.
Good. Okay, if I pop them? You guys done this before too. So bend your knee. Okay, you know what? Right here. Real simple cavitations. Right there. Just keep things loose. On the side for me too. Deep breath in. All the way out. Good, all the way out, sir, right there. Dead right there. Good. That one needed it. All right, come up. That's my bad foot. Feet up. Feet up. Who else has feet problems? I did for a long time. Ever had feet problems before? And you ever had a patient with feet problems? What happens with people with feet problems? Patients? They also have knee problems and back problems and hip problems. When they have problems, what they start doing? They start walking like this, leaning forward. So looking at their overall posture in person, I have someone right now, Efren, he actually probably needs foot surgery from an old injury he has. But right now, he's walking like this. I'm gonna go, Efren, get the cane, don't be a man's man, don't be a macho man, and let your body come back up. Get your body here instead of here. And I think a lot of people forget about that. Because people with a foot problem like, ooh, I don't treat feet. I'm not a podiatrist. You're not, but is that affecting anything else in their body that can help them with? Especially when they've seen your patient for a long time. Sometimes people come to my office, their problems are not chiropractic related, but they want my advice, my partner's advice. What can I do for this problem? That tells you that they trust you with their health. And when you get to that point with someone, it takes time to get there, allows them to actually see the overall benefit of picking your brain. You ever get a question where you say, I don't know? I do all the time. I don't know, but I can help find out for you. You check with this doctor over here. I don't know about that. Let me find out and get back to you on that. What do most medical doctors do? I guess stereotypically for one too, when there's a question and they should say, I don't know, but they don't say, I don't know. We'll try this medication. Let me find out about this. I had a patient come in, real young girl. I'm going to say young girl. She's 25 years old. Came in, severe neck and shoulder pain, but the biggest problem, she couldn't sleep. Insomnia, nurse insomnia. She had seen her doctor for the last 5 years. Doctor says, well, the x-rays came out okay. Well, there's no neuropathy going on. That's okay, you don't need surgery. So what they say, as you guys know already, thank you, is they say it's all in your head. Ever get that? I want to tell the patient, go back and punch the doctor in the face. Get your copay back too, by the way. You know? Because a lot of it is, instead of saying, hey, we don't know yet, let's do more testing, you don't want to put the time and effort to call the insurance company to get that nerve testing, that MRI done. They go, we just think it's your head. See, psychologist, goes like, you're fine. She sees me in my office, my partner and I. Within 2 months, she's gone from sleeping 2 hours a night, maybe 1 hour a night, being a nurse too, to where she's sleeping 6 hours a night. No medications, no neck pain, no shoulder pain. After 2 months, after 5 years of dealing with this. It upsets me because I have kids, you guys have kids too, or a kid. A lot of it is, someone's quality of life has decreased for that period of time. It's upsetting that someone didn't see her earlier. So realize from the adjustments, what you guys do, you're helping someone improve their life for the rest of their life, right? 25 years old. How many more lifetimes does she have? She has 3 more lifetimes to live. That point, that can make her life better, easier, better quality of life, happier. Every patient come in, and sometimes I see it more with moms, because I can joke with them more. And they'll respond to your questions, yeah, no, yeah, no. Chronic neck pain, chronic back pain, yeah, no. And in a couple weeks they go, hey doc, what's going on? Respond like, oh, you're no longer grouchy anymore. Thanks, appreciate it. Brought my office down. Because there was so much pain, become short-tempered, stressed, sometimes anxious, sometimes depressed, right? Chronic pain patients, it's not just their physical body, it's also their mindset, right? You guys check that? In the sense where I go, so you got paid for 2 months, affects your ability to do stuff, you have some burning, some sharp pain for 1, 2. I always ask them, you've had it long enough, does it affect your sleep? Now, it might be on my question, I don't know my question, I don't know what it is. But does it affect your sleep? And if they go yes, I go, my next question is, do you wake up recharged or do you feel like I didn't sleep at all? I didn't sleep at all. And from then I go, because I now have opened the door, I go, does it make you feel more stressed? And I go, sometimes. You feel like sometimes short-tempered? Yeah. Lack of energy? Yeah. And then you go from there, open the door again. Next question is, does it make you feel sometimes anxious? And you go, sometimes. How about depressed? Boom, and you got it. Because then you can go back and go, once you've answered yes to the last 3 questions, but we're stressed, anxious, or depressed, can you relate that back to now the nervous system, how you work it as a chiropractor to make that reverse itself? How do you verbalize that? We all understand the fight or flight system, right? Sympathetic, autonomic system breaks down to your sympathetic to your parasympathetic. Your parasympathetic is your rest and relaxation. Your sympathetic is your stress response. Your fight or flight. Does that affect your nervous system? So it's not, I'm going to tell them, at this point in my examination, you don't have a chemical or mental issue. You have a nervous system issue causing you to feel stressed. Telling you to now feel more stressed. And 2 months ago, that didn't stress you out, and now it does. Can we fix your nervous system to make the overall body better so you feel less stressed, less anxious, and then sleep better so you feel more recharged? They go, all right. Again, stay confident so they're going to believe it no matter what. But then can you show them after your second, third, fourth, fifth, sixth, seventh, 12th adjustment, when you ask them, how are you sleeping? You go, wow, a lot better. Wow, a lot better. And then they correlate that sleeping better with you helping them sleep better because you adjusted their neck, their back, their shoulder, whatever it might be. Does that make sense? Can we make sure they correlate your adjustment with not only their back pain, but also the ability to sleep better, to live a better quality of life, and not be grouchy. And we're like, oh, all the time. Go, oh, you're smiling more now. Thanks, appreciate it. Brought my office down every time you came in. No, don't do that anymore. Again, you got to read the room, but you want to make sure it's a good time to go. They go, yeah, I know, whatever. And they bring their husband in, their wife in, their kids in for them too. How many people see families? I do. And my office has been there. Crap. My office, I bought into the office back in 2000-ish, I think 2002, whatever it was. And it's been off since 1982. So I've been like the 5th doctor in there. Everyone else died. Just passed away. Kidding. Not dead. But a lot is, because I've been there for so long, I'm seeing 3rd, 4th generation family members that come in because my dad and my grandfather came in. And this and that and this. And we were back in Upland when Upland was just a little town. Again, horse and buggy type of stuff. But a lot is, can we relate to that and help their generation so they know chiropractic works for them? Did you ever have a new patient and they were told, I was from a small town in the middle of nowhere, but we had a chiropractor. And that chiropractor treated everyone in the city or in the town, wherever it was, or wherever it was. Because that chiropractor probably, because again, back in the 80s and 90s, it was very not well known or not high reputation, was able to understand the philosophy of chiropractic and get people to understand that portion too. Does everyone use the word self-fixation in office, self-fixation? I do once in a while if they know what it is, but it's a long word. It's a lot of syllables. I can't, those are more than I normally do. A lot, and as you guys know this already too, there's a phrase called, again, universal, like attracts like. When you talk like someone, like as a new patient, and you talk like them, meaning like their volume of voice, the words they use, the tone of voice, their mannerisms for one too, how they sit, how they stand. At that point, it allows them to like you a little bit, and when they like you, they can what? They can trust you, then you can help them with their care. So that initial examination, anyone ever tell you they have leg pain that's called sciatica? Yeah? You too? Not just me. Right? So I go, hey, we're going to help your sciatica. That's what we do here. In my place. All day long. We do. Down the line, as I'm talking to them, as they do the examination, as they do the adjustment, after they go, that adjustment feels so much better. I feel lighter, I feel better. Good, that helped your sciatica get better, right? Yeah, it helped my sciatica get better. So you help them Jedi mind trick back to what it should be. Right? Everyone's different. And you never, and what happens if you correct someone when you first meet them, what they're doing wrong, as I think it's a kid thing, what happens? Do they like you? No, they go, this guy's what's this guy's problem? You want, and you guys know this, right? This is easy. We want to humble ourselves enough to make sure our patients get the ability to understand what we're going to help them with. Chiropractic is not known for everybody. It's 2024, yes or no, but it's chiropractic. Still, people come to my office that don't know chiropractic. Or what happens is, worst case scenario, they think it's something else, but it's not that. Or even worst case scenario, they've gone to chiropractic before, they've been hurt. Have you ever had that before? A lot. They call and they go, my staff goes, ugh. I go, who is it? She's angry. I go, we get the, because if I want to get it, we make a phone call. Make a phone call, and she'll go, hey, he comes in and goes, hey, I saw someone down your street from you. They weren't very, I don't think they were very good. They hurt my neck. Can you help me? I'm like, yes, I can. No, I go, what did they do? Blah, blah, blah. What did they do? What did they do? So I want to know what they did first. If you just go, yeah, I can help you, you have no idea what's going on in your body. Walk them through what's going on. And I always go, if someone does that, it's going to have their own, right? What best thing you can do is say, we don't do that. We can do something else to help you. If you can go, if you find out what it was, and some people call it showing their cards. Ever hear that before? Show the cards, what do they do to you? How'd that work out for you? What's going on? We don't do that. We do something else that may help you. Don't tell them what it is. Just go, oh, you put it on hold, the staff will take your information and get you things as soon as possible. At that point, you're helping them give them a different, hopefully different outcome per se. As a chiropractor, are we artists? I'm an artist. I worked apart for over 20 years now, about 20 years. At that point, even though we're together, we still have a different art form when we adjust someone. Your adjustment is your adjustment. How much pressure you use, how you treat someone, what you do when you're getting that final cavitation for one too. Everyone's different. But can you make sure you're different is going to help that patient as much as possible, as often as possible. I think that's an important thing, right? For all of us, for one too. Okay. Anyone else want to get adjusted? Adjustments? Let's go you first. How about, let me go next. I love it. All right, so walk through a patient exam and blah, 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 all the stuff we do. What's your name, ma'am?
Lisa.
Lisa, Tony, nice to meet you. Grab a seat. Lisa, what's going on today? You've seen chiropractic before, obviously. Do you work solo? Do you work with someone else? Good for you. You have fun. You're healthy.
Yes.
What do you do for health? What's your activity levels like? What do you do?
Gym.
Good. And yeah, anything outdoors?
Oh yeah.
Good. What do you do? What do you like to do? Hiking. Where do you go hiking?
Peters Canyon.
Where's Peters Canyon? Is it around here, or is it somewhere in the hills?
Yeah.
Good. You have fun. Good. This is for you. What's going on in your body today?
I feel pretty good. I have an old shoulder injury on this.
Okay. How do you treat the shoulder? What do you do for exercise, for stretching?
I don't do anything. It's just like I let it hurt.
When you go to the gym, you said, right? So what do you do at the gym to help it alleviate some of the pressure, stress, or do you avoid those exercises?
Yeah.
Ooh.
I'm in avoidance right now.
When you're avoiding it, does it affect your neck and upper back?
by having a bad shoulder. Not bad shoulder, but a tight shoulder. Yeah. And then do you do a lot of lower body then too? Good. All right, good. Let's get you treated for one too. When's your last adjustment?
A long time ago.
Okay. And you always ever ask that if you see a patient for the first time and they're coming in just in your area, they want one adjustment, or everything like that, whatever. At that point, I go, when's your last adjustment? Because that helps me understand, have they had any trauma beforehand or afterwards that puts a red flag in your head? I got to be careful. So there's no trauma since your last neck adjustment, right? Or back adjustment. Do you adjust your shoulder back then too?
No.
Good. If I adjust your shoulder too?
Yes, please.
Let's adjust the shoulder too. All right, let's go right here. Good for you. Ooh, you feel that tumor right there?
I don't feel it.
Good, good. There's no tumor. Okay. Let's go right here. Deep breath, release. All the way out. Shoulder lift. There. That okay?
Yeah.
It's been a while, huh?
Yeah.
Tight
I should
muscle?
have told you I'm like super sensitive too. Okay.
That's okay. Don't even tell me that stuff. It scares me. It's good to sit. You want to sit over here? Sit over a little bit? Don't scare me, Lisa. No. That's one thing if someone is like a little anxious, but I don't really do, I just go for it. That way you can see the reaction right afterwards. And drop for me, take a deep breath in. A little bit of pressure. That's it. Easy? Yes, easy stuff. Let's do your shoulder next. Let's do your good side first. Let's do your left side first. Bring your hand to your ear, just like that. Your elbow in, come right behind you. When you treat someone for the first time, do you walk them through what you're gonna do? Like I'm gonna go behind him, I put my hand here, my shoulder gonna be behind you here. Why is that important? Makes them comfortable, makes you, and makes it safe for you too, right? If I'm walking, I have someone who works in pediatrics. He's an agent. Sorry, I'm trying to take a break right now. And he works in more human resources, customer service, like liability issues. So the biggest thing doctors get sued, pediatrics especially, they don't walk through what they're doing with their patient. Mom's sitting in the corner, they're examining a kid for a hernia, not saying a thing. So when you walk through a patient, what you're going to do for the first time allows the mom to feel comfortable, but also the liability issues. Did you walk through your patient? What you're going to do? Yes. I was going to touch their neck, touch their back, touch your shoulder. You know, who's ever adjusted someone and you accidentally rub against a private part? Happens. Lower back, glutes, chest, whatever it might be. You got to make sure you're verbalizing everything so you go, oh, that's going to happen once in a blue moon. Right? So right here, your left hand to your left ear, ma'am. Knees from your elbow in, right behind you. Take a deep breath in, all the way out. Feels okay? Easy, right? Right here too. Deep breath in, all the way out. Just like that. It's okay? Right now, your shoulder palm you had mentioned where it feels tight. Is it here, AC joint, or more subscapularis in the back of the spine?
So it's in the front and underneath.
So it's almost a teres major comes across the shoulder too. So bring your hand to your ear for me. I'm gonna do it real light the first time. Your head back a little bit. Right there, easy, right?
No.
There you go, right there. And then up here too. Real easy.
Okay, I'm scared.
Okay, I'm just gonna stretch it out. So I'm gonna do just a stretch.
Okay.
You have to stretch one of these up. Why don't you stretch your shoulder now?
Just when I can't hear.
Okay. So go on your back for me. I'm going to show you something I sometimes do with my patients. I take a very expensive water bottle from Costco. I'll sell it to you for $5 later. This is the right arm, correct?
Yes.
Here. I'm horrible left and right, so I always ask. Water bottle here. The water bottle relax in your arm. Let your shoulder relax too. Is that uncomfortable?
It's more like good stretch.
Good.
Like I can feel it.
That's what I meant though. That's uncomfortable. When you ask your patients to stretch, is it uncomfortable? Means that it's not going to guard and tighten. It's going to actually relax and stretch.
It's more painful back here.
Good. So bring your just go over more this way a little bit.
Okay.
Let that arm come out and let that shoulder just rotate backwards.
Oh.
Good. There we go. I want to see their face too when I do a stretch with the patient. That tells me how far you should be going. When you go, oh, I go, as long as it feels just like a stretch, not a guard, at that point we're good to go. This is your stretch for 2 minutes.
Okay.
You ever take a broomstick and stretch too?
No.
Try that one.
Okay.
So here, all the way up. And then see your mid back this way too. So on your back for me. Right here.
How do you think about that for a second?
Yes.
You said you're
Exactly.
here.
On your back, face up. Cross your arms for me. Do you have a lot of pressure on your right shoulder blade also because of the shoulder?
I don't know.
Feels good? Okay, good.
No.
Good. I'm gonna switch arms with you though. I'm gonna bring your left arm up, so I'm gonna use this shoulder blade and that shoulder for leverage when I adjust your mid back, okay?
Sounds great.
Good. Take a deep breath in, all the way out. Good, right there. Deep breath in, all the way out. And one more time, man. All the way out. Right there. Good. So lower back, when you're squatting 500 pounds, how did your lower back feel?
Well, I've had surgery at L5S1, so I kind of take it easy on all that stuff.
Good. Do you stretch your lower back a lot?
Not a lot.
Okay.
Yeah.
Good. How do you keep your lower back? Does your lower back even bother you?
Not very often.
Good.
I'm really lucky. I had a great outcome on the surgery, and I'm pretty lucky.
Awesome. Do you want your lower back adjusted or no?
Sure.
Good. On your side facing me. What kind of surgery do you have?
L5 discectomy.
Cystectomy? Yeah. So no,
Micro, yeah.
there's no rods or
Nope.
screws, things like that.
No,
Good.
and it was decades ago. So it's.
When you have patients that have to have surgery, what do you usually tell them when they have to have a shoulder, a back, or a knee issue? What do you usually tell them? What's a good thing to tell them afterwards? So let me go to. If you ever say, what kind of physical therapy do you after? What kind of physical therapy after you're going to do? Because I always recommend is if you're going to get the surgery, if they're asking what should I do with the surgery, are you getting physical therapy PT afterwards right away to build up scar tissue? I have two patients come in, guy was in his 60s, other guy was in his 30s. They had surgery within a week of each other with his shoulder. One had physical therapy right away, almost the same day, boom, within 2 months he was out walking again, full range of motion and everything. Other guy, his surgeon said, we're gonna brace it for 3 weeks, then we'll start doing physical therapy. 2 months later, he's still like this. Done. So with yours, whatever you did properly, go for it. Worked out well.
Oh, it did.
Yes.
Yes.
Bring your leg off the table for me. Again, mine's a little different. Foot to the floor as much as you can. Get a deep breath in. All the way out. Right there. Other side for me too. Easy.
Sorry.
You're good, you're good. I get kicked all the time, Lisa. Or shin guards. More toward me. The shoulder back. No arm here too. Good, deep breath in. Keep that arm nice and relaxed. Right there. Easy. Good. Coming up. Easy stuff, right? How's that feel?
Feels great.
Good.
Yeah,
Keep
thank
your
you.
routine though, Lisa. This is
I
you.
love that shoulder stretch. Yeah, thank you for that.
And I like that one. You missed one too. If you, anyone have, we all have shoulders, right? We all have shoulders. I take a light band too. I'm gonna go here with your right shoulder, and then slowly behind you as much as you can, just pull back this way. So I'm gonna come back with my arm here and pull back as much as you can.
You're pulling back.
Pulling back that way. Because what happens when you have a shoulder problem, as you know, front muscles here, because I tore mine before, pec minor, anterior delt, bicipital tendon, they tighten. What happens to balance itself out? The back muscles weaken. So we have to strengthen our back muscles, posterior delts, to make our muscles stronger. Even this one too. Hand here and come out this way. So at the gym, cable here, and pulling across your body. Boom. That's what I did when I rehabbed my shoulder. Yay.
Thank you.
You're welcome.
Thank you
Have
so
a good
much.
day. Next. Any questions so far? Are you guys having fun? Are you guys entertained?
Yeah.
Yes, that's what I'm hoping for. I do talks all the time, and a lot of it is going to be education, but also it has to be fun, right? If it's not fun, we're not going to learn. At least I'm not. You know, what's going on?
Right knee. Yeah.
Got Andrea, Tony, nice to meet you. And Jessica. So right now, what caused the injury initially?
In the hip and the knee. Probably I spent kind of like 6 months
Yeah.
driving excessively,
Yeah.
like in the bay to coast
Oof, okay.
a lot, and that's when I started to have more like paying attention.
Got it. How long ago was that?
4 years, 5 years.
And what? 5 minutes? And why did that stay with you? Why is it still there, I guess? What have you done to help it, or try to help it?
Good question. I do mobility with stretches.
Awesome.
My squat is still asymmetrical, so if I squat underweight, yeah, shit.
Does it kind of weaken out too at the end? Second, third set?
Yeah, a little bit, like knee collapse, balance collapse.
Good. So not good, but that's common to have for one too. With your range of motion with your hip, does that feel like it's improving or not improving?
It's okay if I mobilize it, but if I go back into a squat pattern, it'll pinch after a while if I don't.
So before we do anything, I kind of want to check it out. I want to see your hips. Is it equal or unequal? So on your back, from me first, face up. And let's see here. So right now, when I check everything out, as you guys do too, your legs straight for me. We're off a little bit, not that much. Higher, lower. Do you feel that when you're squatting?
I just feel like a pinch and a shift to the right.
Yeah, right now your body is off. So right now, like I said before too with David, is right now we are here. Roll off this way. When you stretch out your hips, do you stretch them out between sets?
Usually before and after.
Okay. Some weeks what I do, because they'll do a lot of squatting or working out with the leg length quality, is go down to, when you face the tighter side, go down to lunge between sets and push up for about 10 seconds. Helps, the biggest thing is that when you're pushing up, like sliding forward and pushing up, helps get that muscle to lengthen, as you know, make that area want to stay loose through the workout, not tighten up during the workout. So I'm going to adjust your lower back, everything else too, based on this being higher, this being lower. So your left being high, so your left being higher and your right being lower. All right. So when I say that, why am I saying that? Because I'll forget to. So I want to make sure I don't forget. See if I adjust your neck this way? No neck issues, right? Perfect. Take care of you. Where do you practice?
San Luis Obispo.
Oh, nice. You came down for this? There we go.
And a friend's birthday party.
Good for you. Double up.
Yeah.
Cross your arms. Deep breath in. All the way out. Yeah, my wife liked to go up there. We like to go to Cambria up there. All the way out. And deep breath in. All the way out. Boom. Again, where's my leg? On the table the whole time. I'm always braced on the table. This is a bigger table. This is also a PT table, not a adjusting table. Always brace yourself to help your lower back get better. We talked about a second ago, because I forgot again. Here, higher and lower, so I'm going to have you do it on your side facing this way for me. I don't tell patients I forgot too, so just want to let you know. Deep breath in, all the way out, right here. There you go. Other side for me too. How much do you stretch, or Andrea, normally?
Once a day, once every other
Yeah.
day.
Good. So you have a good routine.
Yeah.
And one leg drop again, foot a little more toward me. Right there, and then here. Do you see this through my hands like this? It's not this. My hand's open, not closed. Why is that important? You're grabbing somebody. I'm not grabbing them, I'm grabbing them, keep my hand open. That point, let your body stay here, hold the pressure. So there's nothing, can be misinterpreted, I guess. Deep breath in. All the way out. There we go. Right there. Good. You're welcome. Enjoy the birthday party.
Yes.
Have fun. I'll have Ron get you out here early for your birthday party, okay?
All right.
Any questions, guys? Was this fun? Entertained? Hopefully I'll see you next year.